Hello everyone, welcome back to my YouTube channel. This is another tutorial about the hypersensitivity to. In this lesson, we will be discussing about the newborn hemolytic disease type 2 hypersensitivity. So hemolytic disease of the newborn is caused by type 2 hypersensitivity reaction. So first we understand what is hemolytic disease. Hemolytic disease refers to group of conditions characterized by the premature destruction of red blood cells, or you can see the hemolysis. So this can occur due to various factors such as autoimmune reaction, infection, or reaction to medication. One specific type of hemolytic disease is hemolytic disease of the newborn, HDN. Okay. In this condition, maternal antibody, typically IgG, target antigen present on the surface of fetal red blood cells, leading to their destruction or hemolysis. So here we note IgG antibodies are specific for Rh factor or Rh protein or Rh antigen, which is present on surface of RBC other than ABO antigen. Okay. So on other hand, IgM antibodies are specific or bound to ABO antigen, which are present on the cell surface, not Rh antigen. Right? Okay. So hemolytic reaction, okay, are caused due to blood group incompatibility between the mother and the fetus, such as Rh incompatibility or ABO blood group mismatch. Okay, so this condition can lead to jaundice, anemia, other complication in newborn if left untreated. Okay. So next it is the erythroblastosis fetalis. So erythroblastosis fetalis is another term for hemolytic disease of the newborn. It occurs when mother's antibody attack her baby's red blood cells, often due to blood group incompatibility between the mother and the fetus. Okay, so this condition can lead to serious health issues, okay, for the newborn if left untreated. Now the Rh factor. So Rh factor, also known as the Rh antigen, is a protein found on the surface of red blood cells. In this picture you can see individual who have this protein, okay, here it is, are Rh positive, while those who lack it are Rh negative. Here it is Rh negative. And on the other hand, that is the blood type A, blood type B, blood type AB and blood type O. This is the ABO antigen, which are also present on the cell surface of RBC. Now here it is key component of blood typing along with the ABO blood group system. Okay, here it is the development of erythroblastosis fetalis without ROGA. So in picture, when a woman with Rh negative blood type gets pregnant with an Rh positive baby, here it is the Rh positive baby. So there is the risk her body might see the baby's Rh positive blood cells as foreign and try to get rid of them. Normally, during pregnancy, the baby blood is kept separate from the mother's. Here it is separate from the mother's. But when the placenta detached after birth, some of the baby bloods can mix with the mother's. Here it is the placenta detached and this is the blood cells of the baby. Okay, mixed with the mother blood. Okay, so this can trigger the mother's immune system to react against the baby's blood cells. So here it is the cells, okay, immune cells, which react with the Rh specific antigen, and they produce the plasma cells and memory cells. Right? These antibodies help remove the baby's blood cells from the mother's bodies, but they also leave behind memory cell. Here it is the, okay, remember the Rh positive cells. So this means that in the future pregnancy with an Rh positive baby, the mother's body might mount a faster and stronger immune response against the baby's blood cells. However, it's important note that these antibodies called the IgM, okay, don't pass to the baby through the placenta, so they don't harm the baby directly. Okay, so first pregnancy is the safe, but in subsequent pregnancies, the memory cells, okay, so memory cells in her body that produce the IgG antibody can become activated. These IgG anti-RH antibodies have the ability to pass, okay, it is passed to the uh, placenta and attack the red blood cells of the fetus. So it is the once the memory cell recognize the RH plus, okay, cells, blood cells, and they produce the plasma cell. Plasma cells produce the IgG, which is transferred to the placenta to baby's blood circulation, okay, and this can lead to varying degrees of anemia in the baby, which can sometimes be severe and even fatal. Okay, okay, so now next, this can be achieved, okay, this problem can be achieved by giving the mother antibodies, that is the ROGAM, okay, against the RH antigen around the 28th week of pregnancy and within the 24 to 48 hours after the first delivery. Okay. So what will happen? These antibodies known as the ROGAM are also given to pregnant women after procedure like amniocentesis. Okay, amniocentesis is a prenatal diagnostic procedure performed during pregnancy to obtain information about the fetus. Okay. Now, ROGAM works by attaching to any fetal red blood cells. Okay, here the fetal red blood cells that may have entered the mother's bloodstream and help remove them before the mother immune system can react. Okay, so this is the immune system. ROGAM firstly react with the RBC, okay, RH plus RBC. If the mother is treated with ROGAM during pregnancy, okay, so it's unlikely she will produce the harmful IgG anti-RH antibody in subsequent pregnancy with an RH positive fetus. So this protects the fetus from potential harm caused by this antibody crossing the placenta. Okay. Now next, hemolytic anemia can be drug induces. Okay. So sometimes antibiotics like penicillin, cephalosporin and streptomycin along with other common drugs like ibuprofen or naproxen have the ability to stick to protein on the surface of the red blood cells and creating complex. Right? In some people, uh, this complex trigger the production of antibody against this complex. Okay, so drug plus protein which are present in the RBC cells. Okay? When the these antibodies then attach to the drug and protein complex on the red blood cells and leading to the destruction of the cell and causing progressive anemia. When the person stop taking the drugs, okay, so hemolytic anemia disappears. Now, penicillin is particularly noteworthy because it can trigger all 4 types of hypersensitivity reaction, each with its own set of clinical symptoms. Right? So, this is all about today's video. I hope this will help you. Okay, thank you for watching.